I'm Katharine with Healing Through Awareness, and our guest today is Douglas Chandler, the Executive Director and Therapist of Counseling Centers of North Puget Sound. Hello, Douglas.
Hi, welcome, and thanks for having me.
Oh, my pleasure. Would you prefer Douglas or Doug?
Either one is fine.
Okay. So, being that this organization has numerous centers, why don't you tell everybody about what you do, what you offer, and where they can find you?
Sure. Yeah, we have been in the North Sound region since about 1984, and we started as an offshoot of a counseling service in Seattle. They're all Christian church-based, primarily Presbyterian, but they wanted to get some services up here in the Snohomish County area, and so some of the staff there dispatched up here and started our service here in Snohomish. And since then, we've grown to over 6 locations from Mill Creek to Mount Vernon. And sorry, somebody's trying to bug me. All right. So, and we even have an office in Bellevue, although we don't usually go quite that far south. And what our goal really is to provide a safe place for people to do their counseling. And of course, lots of people can access counseling in lots of places, but a lot of people, especially within churches, really feel more comfortable here. They feel like they're more accepted, it's more open. But we also serve the greater community, so we accept people of all faith backgrounds or no faith background. It's not required that you be Christian or anything else, and we really respect each person's individual beliefs. And so people really are welcome here.
Nice.
And the churches provide us with support so that we're able to be a little more flexible with payments and potentially help people that can't afford to pay the whole cost of care. So that's really what we do. It's our mission. It's at the heart of our mission.
That's lovely. So where in Snohomish is the center located?
Right. Our home office is here. It's in Snohomish, inside the First Presbyterian Church off of Lakeview Avenue and 13th. And then we have offices, Woodinville and Mill Creek and Mount Lake Terrace, Lake Forest Park, Bellevue, Everett, and 2 offices in Everett and 1 in Mount Vernon.
So with that many outlets, that many choices of centers, you must have quite a diverse staff to help with all sorts of different problems, issues that people have?
Yes, we have quite a diverse group of people. So we have psychologists, we have a few of those, and we have a number of master's level clinicians who specialize in marriage and family therapy or just counseling, or like myself, are clinical social workers. And then we also have several of our clinicians also came from the pastoring world. So they worked in churches before and felt the call to do more counseling based. So we have the ability to kind of work within all kinds of needs. And we work with people across the lifespan and a lot of different special populations. One of our clinicians, Dr. Urich, a lot of people know her as Dr. Ann, is an expert in autism. So we have a lot of different group or clinicians that can do lots of different work. So marriage and family therapy as well as individuals. I do a lot of work personally with children and adolescents as well as adults, but we have people that also do adults. So it just depends on the location of the clinician, but we work with a wide variety of people.
Excellent. That sounds actually quite diverse. It's something for everyone, so to speak. So within that umbrella, or in that moment, I guess, when you are thinking or somebody's having issues around the COVID fears and how they're coping, being that you work with children, is the family counseling something done together, or is it done separately? Is it up to the clinician? How does that work?
Well, yeah, really it's the partnership with the clinician and the family. And so really it's problem dependent and what the family and the child or whoever brings into the office, or currently a lot of us are doing online counseling, but it's whatever's needed in that situation. And I think most of us who work with kids It's really hard to work with children in isolation because they're really huge piece of their life is their family. And so usually families are involved, especially parents at different points. Typically every session, the parents in for at least part of the time. And I have some kids that I work with that the parents are there the entire time. So it just really depends on what's needed and what works for them.
Well, that's good. Excellent. You know, kids are a special group in themselves because they definitely have a different mindset. They think differently and they ask questions in a way that most adults do not. So having someone at hand or numerous people at hand to help with that it's a lovely thing for the community. Do you also do quite a bit, or your clinicians in and around addictions and things that are happening in our community that have been troubling lately?
Well, with the addiction stuff, that's really a specialized area, and it's not something we've specialized in. We have people that have worked in that field before, like I have, but I'm not qualified to provide that service anymore. So we tend to refer that stuff out and then work with those clinicians if that's appropriate.
I see.
Yeah.
That's just a whole different ball game then.
It is to a point, but you see a tremendous amount of mental health issues with people that are substance dependent or misusing substances of one sort or another. And so at some point we end up working together. And certainly over the last few decades, we've seen a lot more growth in the ability of these two fields coming together a bit more and trying to work in partnership, which has been, I think, essential to success and outcomes for folks.
So those partnerships, are they also nearby? Are they in the area, or is it something that people have to maybe travel to Seattle for?
It depends on what's needed. There's outpatient locations, a lot of places for substance use issues, but when we're looking at inpatient or residential care, that's a different ballgame, and it may require that people travel a little bit further.
Okay. If someone was unsure as to what they needed, but they were seeking help, how do they go about determining which of the clinicians, or how is that determined? Which one of the clinicians might be best?
Sure, we don't have a centralized intake system. So, it's really based on the clinician, and we maintain a lot of that information on our website. So folks can look and read the bios of each provider and look at what locations they're at. We also, people can call each provider individually if they want to talk to them directly. But we have had a lot of folks who, in the last year or two, that have used an online form that we created so they can leave us a lot of detailed information in a confidential manner. So that way, when we go to get a hold of them, we have a lot more information and able to point them in the right direction. So that's, I find, has been very helpful. Because that way, if I can call them back or send them an email, I can just say, okay, here are the providers that are available. I forwarded your information to them. They'll contact you directly. But also, I have a number of people that will contact us. They're not sure at all what they want, and I will call them back and I'll help them figure out what they need. And just yesterday, somebody was calling from, south of Renton and wanted help and gotten some of our names, but we're so far north, it probably wouldn't be practical. So I help them find what might work better for them in their community. We just want to help.
You're all basically pretty hands-on.
Yes, absolutely.
There has been in the past the feel that sometimes therapy and therapists are hard to connect with. And so it sounds like you have opened that up and made it much, much easier for people.
Yeah, we certainly try to. I think in our field, it's hard since most offices don't have reception staff. We don't have people that can answer the phone and point people in the right directions. And so trying to catch up with folks can be a little bit difficult.
Yeah.
And I know when folks are full, I certainly hear it all the time. And I know even within our group or for me, sometimes it's hard to get back to people quickly.
Well, we're all human, right?
Yeah, so that part's a little more challenging, but at least with online service, then folks can email back and forth, and that way they can get some of the help they need a little bit faster.
Excellent.
So yeah, it's a step in the right direction.
Yeah. So I also understand that for those that don't necessarily have the means and funds for, that you have a sliding scale. Can you talk to that?
Yeah, we do. And each clinician kind of manages that within their own practice. So they have a lot of control around that. But everyone dedicates a portion of their practice to folks who can't afford to pay the full cost of care, which includes flexible payment plans or adjusted fee scales, as we call them. But, and there's usually a wait list to get into those services because they're high demand, but we are able to accommodate a number of those folks whenever possible. And it is part of our mission. And the churches that we work with, as part of their hosting us, they give us free space, and that allows us lowering our costs to be able to provide some of those services, as well as
nice.
maintain talented and experienced clinicians. So it allows us to do a little bit of both. And personally, for me, it's been absolutely wonderful to be able to join this agency, knowing that I didn't have, somebody watching over my shoulder constantly demanding that I'm seeing a certain amount of paid clients. That it really, if somebody called up and is just really in a situation, if I can squeeze them in, I can. I had a young man, a teenager who was suffering some pretty severe symptoms and contacted me, and I had him come in, and the insurance was through Medicaid. I couldn't accept that plan, but I have that flexibility to be able to say, no, sit down, let's talk, let's figure this out.
Wonderful.
See what we can do to help. And that's one of the things I really like about being here.
So you spoke to him coming in. So under the COVID, you must have a protocol one-on-one to have people come in. Do you also do this kind of like a video call, or is it just over the phone?
Yes, with the advent, we hadn't done a lot of online therapy prior to the COVID, but when we saw that building in January and February, then we hustled to get prepared, knowing that that was probably where we were going to end up. And of course we did. And so I would say that almost 100% of our services right now are through video conferencing. And we use, confidential services so that it's all protected. We have, in most of our offices, we have enough social distance ability that if we need to, for a particular reason, we can see clients in the office if we need to. Like the office I'm in right now, it can be 15 to 20 feet across the office. So there's plenty of room.
Plenty of space, yeah.
Plenty of space, right.
And because that is, right now, of course, there's a lot of need for it, but there's a lot of fear around being too close, and so that's good to know. That's good to know.
Yes. Yeah.
Well, I'm thinking in the realm of finding therapists, the way you have it set up, the ease of what's online. I did look at the online site, and it seemed a little lean, but the therapists or the clinicians had quite a presence, and that's a nice thing.
Yes, and so that's definitely their entry point. They can get a lot of information about what we offer and what the different clinicians have. And then part of being online for a lot of folks is that now they can complete all their forms that they need to do to be able to start services online. And those aren't directly on our website yet, but soon as somebody gets connected and we set up an appointment, then the clinician can send them an email link, and they just pull up the forms, complete them all online, and they're good to go.
And one thing I did not venture in looking at, but I have a question about, is the insurances that you do take, is that on the site?
It's so complicated. It's unbelievably complicated that we don't have a really good current list of each insurance plan, and it also changes over time, and each clinician can choose which panels they want to be on, and so we don't really have a list per se. So
for someone coming to look for you, they just need to ask right off the bat. Yeah.
Right. Most of our clinicians accept the major plans, the Primera and Primera, Blue Cross, Blue Shield, Regents, those groups, and the First Choice. Those are the biggest ones. Kaiser Permanente, most of our folks take. Then the rest of them, Cigna and Aetna, it varies by clinician. And then a lot of plans have what they call carve outs. So even if my card says Primera, the mental health component might be somebody else. And so that's where it gets so complicated. So we really encourage people to check that out. And we have a list of questions they can use to ask. Yeah, that's the biggest problem. I think we don't accept Medicaid generally, unfortunately. And that's a lot to do with the way the Medicaid rules are. If I could accept them here, I would, but it creates a nightmare for us as an agency. So unfortunately, we don't accept it. Occasionally, some of the managed care plans that they have for Apple Health or under Obamacare, some of those plans that they will contract out of network. So occasionally they will pay a clinician to see one of their clients, but generally we can't see them. And Medicare we accept as well, but that's very limited because the way the rules work, that only clinical psychologists and licensed social workers are able to see those folks. And so there's only two of us right now who are accepting Medicare, unfortunately.
Well, at least there's someone. So is there something that you can add to this, my knowledge of how, an operation or, your facility works is pretty slim. So can you add something that people might want to know that I have not touched on?
Yeah, I think that right now with the COVID situation, everything's up in the air in terms of scheduling and availability. And then, of course, with video conferencing, then that opens up a lot of different days and locations. So even if somebody is in, say, Renton, and they really wanted to see one of our clinicians, they could online. So that definitely makes it easier. But as time goes, especially when we were able to see more people in the office, I really encourage people to look beyond just the prime time hours of after school, late in the day, because those are so popular that it's really hard to find spots for them. And that's where a lot of folks will run into trouble. They will send in their information that they want. You can only come in at 4 or later, and it's, we can't help you, unfortunately. So we really encourage people to be as flexible as possible in terms of trying to find their schedule that will work, schedule and location.
So is that also then within the clinicians, if someone is pretty pressed on a certain time frame, they'll talk with each other and try to find someone that can fit that time frame?
Yes, typically especially when I get referrals from our website, then I have all that information and I can just send it to the clinicians that are potential matches for the person. And because it's all internal, it's all confidential and protected, so we can certainly do that. And then the clinicians will often email back and forth and let folks know if they can accept the person or not.
So not to ask for free advice, but for people listening, right?
Yes.
For people listening, just a little nugget of something that might help them through some of the daily low-level anxieties or fears around the quarantine and not knowing how to navigate some of the emotional aspects.
Sure, it's very interesting. We're seeing a lot of, and hearing about it out in the world too, of course, but a lot of people who are feeling a lot of anxiety, of course, as well as this kind of, and I think with younger people, we're seeing this kind of brain fog, this just kind of low level. I think I saw a clinician online who called it the quarantine blues or something like that, where there's just this low level fatigue, kind of foggy brain, not able to think very well, can't get stuff done, and then this underlying anxiety, which is certainly what we would expect, a lot of anxiety. We don't know what's going on. The clinicians, we don't know what's going on anymore than anybody else. And so that can lead people to a lot of stress. And I certainly know recently just somebody was telling me about, their spouse had brought another adult and their child into the home, even though there's supposed to do social distancing. And there's just this intense anxiety reaction from the person I was speaking with, who was just like, I didn't know what to do. And just immediately this reaction where people are basically fearful at that point. We see that extreme, or the people like, I don't care, I'm fine. And they just don't do anything different. It's a real interesting mix. But I think in terms of managing some of that anxiety is recognizing the parts that I can't control. I don't know the answer and I don't have to know, right? All I can do really is focus most on the things I do have some control over, which is, how much exposure I give, how often I go outside of my house, those kinds of things. And I need to be able to play those odds. It's hard to know what the odds are right now because we don't know what makes it more dangerous or
Right.
less.
Yeah.
But we're not going to know for a while. And so some of it is if I'm focusing on, I don't know, then my anxiety is going to go up, right? And then the problem at that point, as soon as my anxiety is more than just a little bit, the anxiety is my problem. It's no longer the COVID or anything else, because in that moment,
Gotcha.
when I
Yeah.
can't think, I can't sleep, the anxiety is my problem. And so then if I am able to focus just on that, okay, if I rate my anxiety 0 to 10, anything above 4, it's going to start getting out of control. So as soon as I realize that, then I can focus on calming down and think about, okay, I just need to calm down. Take some deep breaths, just relax, find something to do, just get my stress level down. Because then once it comes back down, then my brain will come back on. I can think a little bit more clearly and I can figure out what I need to do.
That's a
Really
great piece
probably
of
the most
advice.
important.
Yeah, I think that's really, it's base, but it's so key, and that's a good, helpful piece of information. Well, do you have any other tidbits that you'd like to add?
I don't think so. We haven't seen a lot of people expressing suicidal ideation, but I'm certainly reading in the press that the suicide rates are increasing dramatically.
Oh,
And the calls to the suicide hotlines across the country are going up substantially. We know that with decreased employment, that the suicide rates in adults go up a lot. And so I think that tells us some things that we need to pay attention to. And while we're not seeing it a whole lot in our offices at this point, I anticipate we will, of course. And so I think that's something to pay attention to both in ourselves and in others, is if we're not sure about what somebody's doing or if they're doing okay, is just to ask them. And I tell folks a lot, especially parents, they're afraid to ask their children if they think about dying because they're afraid that it'll make them want to, or them, in all these years, I've only heard one time somebody ever say, when I asked them, do you ever think about dying? I've only heard once. They said, no, but now that you mention it, only once. They don't. It just doesn't
right.
happen.
It's not
And
how it's connected.
No. And most every time you get a pretty good answer. And I've plenty of times where people have felt suicidal and they've been afraid to tell their parents. I just ask them and they'll say yes. And then we can work on it. And I think that's super important, is just to ask. And with parents is to notice the differences in their children. Adolescents like to isolate anyway, but are they isolating more than usual?
Right.
Did they stop talking about the future? Did they say things like, I don't care anymore, or that doesn't matter? Those kinds of things. If we're not sure, we just ask. And there's tons of information online, and suicide helplines and the crisis lines are available. So people can certainly, call for assistance. And
So
then
in
otherwise, domestic violence is a
sorry.
big risk. Go
Yeah.
ahead.
In that instance, if, as opposed to using a hotline because someone, for some reason, whether past experience, has a trust level in your operation and they
Mhm.
call you first, what would
Absolutely.
you speak?
If it's urgent, if the person is not sure if they can stay safe, if they need to be seen in the next 24 hours, or something like that, we're probably not the best option because it may take several days or a week or two for us to schedule somebody. So in those cases, we really would refer them to the urgent care clinic, the primary care doctor, or even the emergency room if needed. But yes, definitely people that know us certainly can call. I've had a few people call recently, just really having a hard time that I haven't talked to in a long time. And they've called up and I'm sure I'll fit them in right away.
Nice. That's good that people need that comfort of what they do know and the proximity of being close by. It's nice that that's an option for them. Well, at this juncture, I feel like we've kind of hit the points Once again, unless you want to throw something at me, and
Oh, I think that about covers it. And like I
I
said,
think it
people
was
are more than welcome to contact us. We'll be glad to help if we can.
a lot of very, very good information, and I really appreciate your time and talking with me.
And thank you again for having me.
You're more than welcome. And on that note, thank you everyone for tuning in and paying attention. This is Katharine with Healing Through Awareness, and we've been talking to Doug Chandler of Counseling Centers of North Puget Sound.